Our deep thanks to Bono for that great video. And I'm David Kramer, the Executive Director of the Bush Institute, and I think you all know Bill Gates. Though I think you may not all know this particular episode of Bill Gates. Scott, if we have that video clip just to show real quick. So my question is, how many chairs and how many bones did you break practicing that skill?
I didn't get much exercise back then. I mostly just typed, so that was my...
That was your exercise.
I can't do that anymore, so...
No, I'm not going to ask you to demonstrate that, so... let's dive right into it. You wrote an op-ed in the Washington Post very recently, last month, calling for Congress to reauthorize the PEPFAR initiative. You said U.S. policymakers can build on PEPFAR's remarkable progress and save millions more lives by continuing their bipartisan support for global health programs, including congressional reauthorization of PEPFAR by September of this year. Why is this so important to you?
Well, HIV is still a huge problem. We've cut the death rates down substantially, but if we don't continue to provide these medicines, then people's viral loads go up, they become infected, and you get that exponential increase that we saw with all infectious diseases, including COVID. So this program has been so phenomenal, it actually hasn't gotten that much visibility. I mean, there haven't been the corruption scandal around PEPFAR, the mistargeting around PEPFAR. PEPFAR has been a program that's continued to learn. It learned how to help pregnant women. We went from nevirapine to actually putting people on full treatment as soon as they tested positive. It learned about the drug regimen. We got constantly better drug regimens and drove the prices of those down. So this thing is, kind of a mind-blowing success, and almost, that's made it bipartisan enough that I worry people don't understand how important this is. This is the most generous thing America's done since the Marshall Plan, and it has been extremely well executed, and we still need it very badly.
So over the past 2+ decades, you've visited many countries in Africa and elsewhere that have been affected by the HIV/AIDS pandemic, and you've met a lot of people in the field working on PEPFAR. What experiences have stayed with you in that?
Well, one incredible thing about HIV, there's always a question when you deal with human health, do you actually show the disease or not? And it's kind of shocking to see sick people. In the case of HIV, the before and after, somebody who got their CD4 count down, say below 50, and is just completely emaciated, then they get access to these antiviral drugs, and they resume essentially full health. Their life expectancy goes back to being very near to what it was even if they didn't have HIV. So I met Florence when her CD4 count was about 40, and then I met her a few years later when she had been taking the drugs, and she looked great. I mean, it's almost like a Lazarus effect where you look like somebody who's 70 or 80. I don't mean to offend anyone, but and then she was 40 years old, and she looked 40 years old after that treatment. She also had children afterwards, and because of the reduction in the viral load, that meant that what happens if you have no intervention, which is a very high risk of infecting your baby with HIV during the delivery process or through the breastfeeding, she avoided that. In some ways, that's the ugliest face of AIDS, that it is transmitted from a mother to a child. And infant HIV is much worse in terms of its difficulty of treating it, although the US figured out how to retitrate those pills and get involved. So lots of kids have survived. But just by preventing that infection, you avoid that altogether. So she, is the face of something. And, I think it's great for people to go to Africa and see this and meet the people. Saying you're saving millions of lives, that should be evocative. It should be like 10 times more evocative than 100,000, 10 times more than 10,000. But somehow that one person is more emotionally connecting.
Putting a human face on it. And
Right.
we have some beneficiaries here today. Why should Americans care?
Well, Americans, have values. We've, in a pretty unique way, seen tragedies out in the world and stepped up to build the institutions and make sure those institutions are well run. Institutions that prevent war. We saw in this latest pandemic, the funding for the vaccine work. The U.S. was the vast majority of that funding. Actually, the second was a group called CEPI that my foundation's involved in, but it was much smaller than what the U.S. put forward. The U.S. is willing to think ahead, and Africa would have today 30 million orphans that fortunately it doesn't have because their parents were saved by the availability of these HIV drugs. And the whole endeavor drove down the cost of those drugs. I mean, they were fairly cheap, but now we make volume guarantees to the generic manufacturers. They understand that the demand is going to be there. They can plan ahead for many, many years. It's phenomenal how things clicked in. And at the time this was being formulated, President Bush took a risk because there were certainly voices saying, will the compliance be good enough? Will the distribution be there? Will there be some way that corruption seeps into this system? And, now all of that was avoided through great management.
You have been a leader, a pathbreaker in technology, and pharmaceuticals rely on this. There was an amazing job done in finding a vaccine for the COVID virus. We still, after all this time, don't have a vaccine for the AIDS virus. How do you see the future of that?
Yeah, it's funny because about this time of starting, I made a gift to the foundation, which makes it a significant foundation, and we picked global health as our primary activity. So I'm a very naive person in global health, but very committed. And so I, in a meeting with Dr. Fauci, who I met at that time, I was saying, come on, let's get this vaccine. He very appropriately said, hey, there's reasons why this one is very difficult. And so here we find ourselves in 2023, working hard, all of Tony's best ideas, the foundation's best ideas, researchers everywhere. And, I'm allowed to be optimistic. I think we are finally on the track, but it's proven to be extremely, this particular disease, because it is a disease of the immune system. Now, the work we've done to come up with that vaccine has forced us to learn so much about the immune system. The whole world of cancer vaccines, which is just getting started. The mRNA approach is one of the things that will be applied there. They're benefiting from the intellectual knowledge that came out of all of this immune systems research, where the primary funder is the U.S. government through NIH, NIAID, Tony's organization. And literally right now, there's a vaccine construct that the U.S. has backed that it comes out of some work at Harvard Raygun Institute, and we'll use an mRNA vaccine, probably from BioNTech, to see if we can finally get a great vaccine. In the meantime, there are now drugs that are so powerful that instead of somebody who wants to avoid getting infected, we may be able to have a rod that you put in and lasts for like 6 months. That looks very promising. Also for people who are on treatment, today we still have a daily pill. It's a combo pill, but there are various antivirals whose activity is so high like cabotegravir and a few others in the pipeline, that hopefully you'll only have to take treatment once a month or once every 3 months, which would both be easier for the patient. The logistic cost of delivering these medicines would go down. So in prophylaxis, which is a drug or the vaccine, in treatment, which are drugs you don't have to take very often, and in the ultimate, which is called cure, where you may use gene editing, and this is 10 years away at best, but the Francis Collins and Tony Fauci created a partnership with others, including our foundation, to go pursue this, and actually it's looking very promising. Now, the cost of gene therapy, the way it's done today, is millions of dollars, and of course it's not practical to use this unless it's a single shot, and we could do it for, say, $1,000 or $2,000. So it's a very high bar that to achieve. But I think we will have all of these new tools, and the energy behind them is that we know that PEPFAR will be there to deliver the latest tools to the people in need.
To maybe not people in this audience, but anyone watching online who might be sitting there thinking, how come the United States always has to take on the burden of this? In fact, for this effort in dealing with the HIV/AIDS virus, it is a global effort. The United States plays an absolutely indispensable role, but there are others who play a key role too.
Yeah, in terms of overall foreign aid, the Europeans are very generous. I mean, they're about 3 times more generous as a percentage of their economy. So we shouldn't downplay that. When it comes to health, though, the U.S. has played the leading role. We have the expertise, the research. We've organized these programs extremely well. In that early period, right around the year 2000, not only do we create PEPFAR, it's the largest, it belongs at the top of the list, but also under President Bush's leadership, the Global Fund is created, and the U.S. gives 1/3 of the money going into that. President's Malaria Initiative is created. That's bilateral, fantastic program. And the Global Alliance for Vaccines is created, and the U.S. has been about 20% of that. So we're not just using our bilateral capability, we're also using our multilateral capability and drawing in. In fact, last September was the latest every 3-year replenishment round for Global Fund, and even in the face of all the demands, energy costs, inflation, Ukraine war, through the U.S.'s leadership, we were able to increase the amount of money for Global Fund. So it's not just the United States, but none of those things would have come together without the strong leadership from President Bush and the United States. And the continued, the people who, loved PEPFAR, sadly, a lot of them are now retired. And so one of today's strong messages, I hope, is for younger politicians to go to Africa and see this work. And feel free to question, could we do it for less money, or should we be funding this innovation? This is run like all of global health is, and that was not true in the year 2000. But global health is run as a very reasoned, it's a greatly moral thing, but we don't spend the money just for that reason. The money gets spent because it's well thought through. And things like which patients need to see a doctor how often. We went from the US model, which is very personnel intensive, down to, okay, this patient is having a rebound, so they need to come. And a lot of patients go half year without needing to come in. That's one of the incredible innovations, because as people have stayed alive with HIV, the number of people living with HIV is now a much bigger number, and yet the PEPFAR number's gone up a little bit, but not nearly the same. So the cost per treatment, we've had PEPFAR, I use the word we because there's all these get-togethers, but PEPFAR is the dominant part of this. they've had to think through the cost per treatment and bring that down dramatically, and also integrate into the health systems. In some cases you do integrate, in some cases in urban areas where you have lots of HIV, you keep things separate, but they've been very smart about, okay, what is the cost per life saved?
I think you mentioned people living with HIV/AIDS. There are, I think, 38 million or so who have been diagnosed accordingly. There still are over 600,000 people who are dying from AIDS-related illnesses, which is way down from where it was 20 years ago, of course. But there are some segments of populations and countries that are especially affected by this. Women, girls, those in the LGBTQ community. How do you see how we can address those challenges?
Well, the inequity of HIV is kind of mind-blowing, because it's overall what you'll have is young women as young as 14 or 15 who are infected by older men. And so just because the nature of transmission, a slightly higher percentage of women are infected than men, particularly at those very young ages, but even as you go up into your 20s, it's still a higher percentage women. Now, women are better at seeking treatment. And so if you look at that residual of 600,000 who die, it's people who don't get themselves tested and don't get onto the medicine. And that number has been brought down. It's still a number we need to look at every year and say, wow, why is that? Because the drugs are there. There's a thing called an HIV self-test, where it's a very daunting thing to go in and give blood and have somebody tell you that you're infected. So one of the things that's been proven out is HIV self-tests, which is available quite a bit and is scaling up even more. So in any case, men, particularly older men, are very heavily represented in that 600,000. Getting them to seek out the test and then start treatment and stay on treatment has proven to be more difficult.
How has PEPFAR supported development of other systems that can be very useful when health challenges arise, such as COVID, Ebola? Your foundation has also been playing a critical role in developing these kinds of systems, infrastructure, so that countries are in better positions to tackle these challenges.
Well, the overall seriousness of helping African countries run good health systems really took off in the year 2000. The ability to even measure the burden of disease, up to that point, there'd been a World Bank report, but it grouped all the deaths. There was like diarrhea, which there isn't something called diarrhea. There's many pathogens, and so how you do vaccines or drugs are different. Respiratory disease was a big category. Deaths under the age of 30 days were gigantic. And so it's hard to overstate how we had neglected bringing the world's intellectual power to really look at, okay, what is the burden of disease? In that time frame, just to focus on children briefly, 10 million children under the age of 5 died in the year 2000. Because of the combination of all these efforts, including the new Gavi vaccines and making sure that HIV wasn't being vertically transmitted, that number's down now to less than 5 million. So you've cut in half from about 10% to less than 5%, the percentage of kids who die under 5. And getting Africa to get out the vaccines and have health posts that are well-staffed and well-stocked and well-trained. And PEPFAR's played a huge role in this, because PEPFAR realized although in the big cities, they can do a special location, and particularly when you have people who are sitting in a waiting room who might have TB, you want to get some separation. But out in the rural areas, you've got to integrate it in. So you've got to train those rural workers. How do you give an HIV test? And okay, how do you handle the referral up to the next level of the health system? And so there's still challenges with these primary healthcare systems, but they are dramatically better. And the biggest factor there has been PEPFAR. All the other efforts, President's Malaria Initiative, Gavi, Global Fund, they all realized that having that basic health system was very important to them. So they, working with WHO and World Bank, now there's an overall plan for each country to say, okay, here's our plan for our health system, and here's how the funders fit into that. And so, PEPFAR, a lot of its money, it doesn't just write checks for the drugs. It doesn't just try and fund the prophylaxis. It is there with great personnel on the ground, both USAID and CDC people in the 20 countries, helping to make sure that system is well run. So the biggest funder, say, of supply chain reform is PEPFAR money, followed by Gates Foundation money. So the seriousness of global health and the result is incredible, and that starts with PEPFAR.
Bill, we're out of time, but let me ask you one last question. President Bush likes to use the phrase, to whom much is given, much is required. You have been incredibly successful in your career. Why do you do this philanthropy work?
Well, my work at the Gates Foundation is my full-time work. I'm super, super lucky to have two careers. My IT career, which I still have as a hobby, thinking about AI and all sorts of interesting stuff, which we're going to apply to healthcare in a very impactful way. But learning about these diseases, getting to work together with the team at the foundation, getting to work with people like Francis Collins, Tony Fauci, I mean, this is such interesting work. And we have great results. We have enough things going on that, we'll have a vaccine fail or a drug fail. But we have all other vaccines, HPV, typhoid, cholera. The story of global health is a very uplifting story. Of course, our lack of preparedness for COVID, we could have a whole day talking about that, and hopefully we will be ready for that. But it's I consider God's work. President Bush's leadership is partly, what made it clear that this would be the area. So I do it because I love the work, and it's where the resources should go.
Bill, thank you. Thank you for being here, and thank you for all you're doing.
Great. Thank you.